From grassroots efforts to policy reform, how can advocacy rewrite the rules of an entire system?
Advocacy it's kind of this term that people use in a lot of different ways. I'm curious, how do you define it and why do you do it?
Advocacy really started for me as a very personal thing. I had a loved one that suffered from opiate use disorder, and at the time, Medicaid in Indiana did not cover opiate use disorder.
What began as a single testimony to save her loved one has propelled her to empower thousands of advocates serving hundreds of thousands of Indianans.
And I have the honor of representing all 24 community mental health centers in the state of Indiana, and they provide services to over 350,000 individuals that have substance use and mental health disorder needs. And we also represent a number of affiliate memberships. So
learn about some of the tools that convert stories into policy.
Some of the tools that we use are local site visits, getting people to your local organizations, going on a mobile crisis response, seeing the crisis stabilization center, meet the workforce. All of us have amounts of workforce that contribute to the economics of any state.
And the influence of unexpected voices, which compel legislators to listen.
Who are some of those unexpected messengers?
People weren't really paying attention until Major Lynch came with his uniform and his holster, and he started sharing how the work of crisis and the work of certified community behavioral health clinics, they have seen burglaries go down, domestic disputes go down, they have seen thefts go down in their area. And he spoke about how it allows his police and his force to stay safe and keep the community safe.
Learn how personal testimony, data, and unexpected allies reshaped Indiana's mental health system on this episode of Wellbeing Wednesdays.
Hello, everyone, and welcome to Wellbeing Wednesdays. My name is Brett Beckerson. I am a social worker by training, and at the National Council, I'm a senior director of policy and advocacy. Today's conversation will be joined by Zoe Frantz. She is the executive director of the Indiana Council, one of the association executives that we have across the country, doing lots of advocacy around mental health and substance use care. Well, hey, Zoe, it's so great to see you.
So good to see you, my friend. How are you?
I am doing great. I was thinking when I knew we were going to have this conversation about our first ever encounter.
Mm-hmm.
And I love it. I use this example all the time when I'm talking to people. I had just started a national council, and I was giving an Advocacy 101 presentation to some folks in Indiana. And while I'm trying to go through my slides, I'm getting these little private messages asking me very detailed questions about, well, could we do this or could we do that? And they were awesome questions, and I loved it, and it made the conversation so much more robust. But I took a little note, and I said, Zoe F. Indiana, great advocate. And then, I think it was 6 months later, I get a press release saying that you've been hired as the executive director for the Indiana Council. And I was like, amazing choice.
Yeah.
Fantastic.
Thank you.
I loved it so much. But I gave a little peek into kind of who you are and the work you do. But could you share a little bit more about yourself and the work you do through the council?
Yeah, absolutely. So my name is Zoe Frantz, and I have the honor of representing all 24 community mental health centers in the state of Indiana. And they provide services to over 350,000 individuals that have substance use and mental health disorder needs. And we also represent a number of affiliate memberships. So people don't usually know that, but that was one of the things that I wanted to do when I started in this role to expand our advocacy reach, is bring other partners to the table. And I will remember you always because you were one of my first phone calls that I made when I got the role, because I was like, what am I doing? And I realized really quickly that you need, as an advocate, to have friends and resources, both federally and locally, to help in really processing through what is the best advocacy at that moment. And I'm really forever grateful for your friendship for that.
Well, the gratitude goes both ways.
Yes.
Being a senior director or doing public policy work for National Council, we often need to know, okay, what's actually happening on the ground, because, in DC, it can be, a 30,000 foot point of view. So, having our kind of symbiotic phone a friend makes it work both ways. Advocacy is something that, it's kind of this term that people use in a lot of different ways. I'm curious, how do you define it and why do you do it?
Yeah, absolutely. So advocacy really started for me as a very personal thing. So I had a loved one that needed help, and this was a number of years ago, and he suffered from opiate use disorder. And at the time, Medicaid in Indiana did not cover opiate use disorder. And so during his journey of severe substance use disorder, in and out of treatment, in and out of services, never could get the right funding to be able to get him the care that we needed until we were able to get Medicaid to be able to support opiate use disorder. And so I'll never forget that moment testifying on the state House and Senate floor in honor of my loved one to be able to get that service in place. And now looking back on that, that service has provided coverage of care to over thousands of individuals. It has saved lives, including my loved one who was really at risk of losing his. He is now a phenomenal father, and he is a phenomenal brother and uncle and worker of society. And it was getting him the resources that he needed. And he did that within a community mental health space. And so my journey as an advocate has been in a variety of different roles. I've ran a number of facilities. I've worked in community mental health. But then that personal journey and that professional experience of working in community mental health, he wouldn't have been able to get those services if they were not right in his backyard, where he could walk to them, get to them, navigate them, have someone who helped navigate those services. And so for me, that advocacy is really tying that personal and professional voice together to be able to speak to people and advocate for what they need.
I love that. And, what I specifically love about that is that you're kind of making this connection because so many, I think everyone in America can be an advocate, right? Because we've all been in that situation where someone we care about, someone we love needs something. And whether it is access to a mental health or substance use service or access to a other kind of specialty care, right? Dentists, et cetera. We've all been on the phone with people saying, June's not soon enough. I need to get in sooner than that, right? Like who knows what could happen in the next couple of weeks. So that advocacy that you're doing on the phone with providers, you can mirror that and echo that to policymakers. That same passion, those same stories, those same data points of, just how severe things are or how bad or how hopefully how bad they won't get, right? If the care isn't there. I wanted to, talk a little bit about your clinics because, as a membership organization, your primary advocates are the providers you have. Why is that voice so important?
Yeah, absolutely. So I also believe it's those that they serve too. And so those providers, like I shared earlier, serve 350,000 individuals in Indiana. That is not a small voice. That is not a small system. It's about 15,000 staff. And so each of them brings a perspective, whether it's a peer or whether it's a CEO, whether it's a case manager, a psychiatrist. Each of them brings that perspective to what treatment means and what giving people what they need at the time that they need it and why it's so important in mental health and substance use disorder. And so all those voices together really help paint that picture for legislators. It brings the data, right? We have our data analytics group that are so crucial. We bring our CFOs because we need to do it in a sustainable way, in a way that we're good stewards of those funds. We bring the clinicians to talk about the clinical stories and the impact that they've seen. And so that provider voice, no matter who you are within that provider, that's such a vast term, right? No matter who you are within that, you have that story to tell to be able to really give that legislator in your district that true, that's the thread that connects, right? And so I often say they are our local voice to start it locally to help us thread it to the State House. So when I'm at the State House or my wonderful director of government relations is at the State House, they can say, oh, that was the local story we heard here. So now that's connected to then our federal story, right? And so it's this beautiful tapestry to me is the vision of advocacy, and that all weaves together so that then people can actually have that as a visual to see.
And you mentioned you basically kind of carved out or called out like a care team, a folk, and over the years we've advocated to include folks like peers, to include the opportunity to build a team to address a person's needs. And I think policymakers get that, right? Because they have the team, right? They have a schedule that's making the meetings. They have a researcher who's doing the background work. They've got somebody who's like, discussing the opportunities or potential barriers to getting that work done. So they get that you need to have those teams to be able to address individual issues. And so, being able to have all those different members there and sharing a unified voice is really powerful. When you're doing that, what are some of the tools that you have to kind of make that message sing?
Yeah, absolutely. So I would encourage folks, some of the tools that we use are local site visits. So getting people to your local organizations, going on a mobile crisis response, seeing the crisis stabilization center, being able for them to really meet those individuals in which you serve, meet the workforce. Talk about workforce. All of us have amounts of workforce that contribute to the economics of any state and federally, right? So have them meet that workforce. So definitely site visits are a main tool that we do a lot of at the Indiana Council and help facilitate those both state and federally. We do a wonderful State Hill Day where we go to our state house. We had over 100 folks this past February. We have them connect with legislators. We educate them on the policy and then have a showing of mental health representatives at the State House. To me, it's just such a wonderful, empowering visual. And then from there, we'll go to National Council's Hill Day, and we'll bring that same local voice and have those advocates there. And so again, we're threading that needle through in all points of advocacy. And then we have other things like, of course, your website can never be, forgotten about. People go there for tools. So always make sure you have your advocacy toolkit on there, that you have the data that you need for folks. I cannot stress enough the data component of what we've done to really paint the picture of the lives that we serve, and the workforce that does it really speaks well to legislators. But then also we've done a piece alongside that to be able to share the client story. So it's not just a number, it is humanity, and it is a life that we are advocating for.
That's fantastic. And I appreciate how you talked about how sometimes that thread that you're pulling with a policymaker or the way that you're going to kind of pique their interests, it can be that very heartfelt story of like we're saving lives. And other times it's this heartfelt story of how we're bringing in tons of jobs into the community, or how we're saving lots of money or making that community more independent. We often talk about healthcare. Maybe there's just kind of misnomer within the media of healthcare being a more left-leaning topic. But firsthand, being in Indiana and having, I think, a beyond supermajority in your legislature of Republicans, that like this is a truly bipartisan issue. I wonder if you can speak to that a little bit.
Yeah, absolutely. So mental health, no matter the side of the aisle, there are people that have been impacted by mental illness. It's 1 in 4 individuals, right? And so when we did our large advocacy effort 2 budget sessions ago with Senate Bill 1, where we put in place crisis and certified community behavioral health clinics, we had representatives and senators from all over both sides that came to sponsor Senate Bill 1. It was the number 1 priority in the Indiana state, which just to me as a lifelong advocate says it can be a bipartisan issue. And so we had people from the lieutenant governor to, Republican House representatives come and testify and share their stories, some tearing up as they're giving this testimony about their loved one. And so seeing that impact, it is all about the person in policy and not about the politics. And so you have to step away from that, right? Step away from that, which, for me, and you need to stand in the middle of the road. I always have that vision of standing in the middle of the road. And I wear actually this compass around my neck because someone gave it to me when I started. And they said, don't ever forget your North Star. You're going to get pulled to the east, the west, sometimes the south, but your North Star is mental health advocacy. And as long as that is at the forefront, then all the other things will come into place. And so that's what we need to do to bring people together.
I think that's important. And, kind of building on that too, having so many voices really helps to show the impact. But I don't think people always realize that, some districts, some areas matter a bit more.
Yeah.
And so, if you may not know that you live in the community where the chair of the finance committee is from, that you guys might rub elbows by accident at the grocery store.
Yeah.
And being able to share, hey, here's the clinician who's embedded into the high school in our community. This is the person who's at the local food pantry, making sure people get access to services. That's making your community so much better and more open for folks. So just being able to kind of reach out and say, hey, how can I share my voice either as like the aggregate and the community, or sharing that specific voice to that person who really has the power to push a bill forward or not.
Yes, absolutely. And I do think you said something there that kind of struck me. You need to know who you're talking with.
Yeah.
Right. And so you need to know, too, what their local pain points are, maybe what some of their personal situation is. And so when I go back to that whole thread analogy, I do believe in advocacy. There is a common thread that you can pull. I'm still trying it on some, but I know that it's there, right? And so as soon as it is, whether it's workforce, whether it's economic development, whether it's, having a personal story as someone being impacted, whether it's having kids, right? Being a parent and having a place for your kids to be able to go and talk about mental health and wellness and thriving, right? And so knowing those threads are really helpful in conversations. So doing your research ahead of time is helpful.
And you made me think of something, when I was in social work school, somebody said to me, you never know what you've said to someone until you know how they've heard it. And when a social worker or when a provider, who's working on mental health is saying something, they might hear it differently, kind of from this kind of nonprofit point of view in space. But I'm wondering, who are some of those unexpected messengers that when they are saying maybe the same talking points, maybe the same thing, it's heard a bit differently by policymakers? I don't know if you have any examples.
Oh, I have perfect examples. So just this past budget session, we had testimony to advocate for the funding that we needed. And there was a bunch of folks, and everyone was, up there listening and heads were down. People weren't really paying attention until Major Lynch, and I will say him by name because I'm so proud of the work that he did, came with his uniform and his holster, and he sat down next to our community mental health provider, and he started sharing how the work of crisis and the work of certified community behavioral health clinics, they have seen burglaries go down. They have seen domestic disputes go down. They have seen thefts go down in their area. And he spoke about how it allows his police and his force to stay safe and keep the community safe. And then the community mental health member to be able to take care of the mental health needs. Heads went up. People looked, they were paying attention, and it was having that police officer. And then right after that, we had a wonderful county commissioner come, and she shared the story about the local impact that she's seen in her community with the work we're doing with crisis and certified community behavioral health clinics. And so having those different key stakeholders, whether it be justice, whether it be teachers, whether it be business and industry is another key, right? There's so many key stakeholders, and having all of them, the past DMHA, Division of Mental Health and Addiction Director said it well, you got to get everyone under the same tent.
Yep.
And so having that tent and having that voice and advocacy is really what has made Indiana move forward.
That's great. And I think about, like, there's all these National Council, we have over 3,500 clinics in, all 56 states and territories. And they come to us and they say, what can we do? And one of the things that I love to tell them is, I'm saying, does your local, do the police chiefs in your service area know what you're doing?
Yes.
Does the sheriffs of the counties that you're serving know what you're doing?
Yes.
Do the jail administrators know what you're doing? Do the mega churches or churches in your community know what you're doing? Because, what's the adage? Like, if we go alone, we go fast, but if we go together, we go far.
Yes.
And that's the togetherness and that community voice. Because, in my understanding, the only way you would know about this major is because there was a relationship with the clinic, and they reached out and made that happen. And so, when folks are coming to us and saying, we need to do more, we need to do more, I'm like, here's a few things more that you can do. Because again, you might know them from the grocery store, or you could go to the same church. Like, these are all things that, if you build this network, we can help galvanize that and move that into a way that makes, bigger change, and maybe bigger change faster.
Right. Absolutely. I can't stress it enough. And there's so many of those key stakeholders to have at your table in your advocacy and having your fight as you're advocating for mental health. There really isn't an industry, a market, a person who's not impacted by it, right? If you don't have someone mentally well, they can't work. So therefore your workforce, right? I think that's one of the number one reasons for people being absent from work. And so, employers, schools, it just goes on and on.
Yeah. So part of my background is more in research. And the next question I want to ask, I think about it as a researcher because, how you measure something. But, when you think about well-being, the National Council for Mental Wellbeing, what does well-being mean to you?
Yeah, absolutely. I've been reflecting a lot on that this week with being, in finishing up the legislative session here in Indiana, and well-being, and what does it mean for our state? What does it mean for me as an individual? What does it mean for my staff and those that we serve and our providers? And well-being to me is really more than the absence of illness. It's a place of thriving. And I have this vision of Indiana and really all across, the United States, of people thriving with mental health and substance use disorder. And not only those who have those disorders, but also those who service them. Our workforce, I mentioned earlier, it's around 15,000, staff, and that doesn't include others outside of community mental health. Our workforce, through COVID and through, times now, they need to be in a place to thrive, to continue to serve those with mental illness and substance use disorder. And so what does it look like to have a thriving workforce? And for so long, our community mental health system has been this infrastructure that's been built with a big gaping hole, right? And we've had little things to kind of fill that hole, to kind of braid it and piecemeal it together. But certified community behavioral health clinics and 988 and crisis, we cannot go back on that advocacy. We need to go forward, because that, to me, is where we will thrive for those that we serve and for our workforce. People love the model, whether it's workforce, community stakeholders, or those who serve it. And it is a model that allows people to thrive. So that, to me, is what wellness means. We just need to get that east to west, north to south, and
find your compass.
Yes, find the compass. Absolutely. Yes.
Well, it's been amazing speaking with you today. I think we've covered a lot of ground. Any kind of final thoughts that you want to share with the members of our organization, with advocates out in America that'll help make a difference?
Yeah, absolutely. I think all of us have a story, like I shared mine with you earlier. And I think whether it's you or someone that you know, that sometimes we do need to dig deep for that advocacy, not let the fatigue get to us, but really use each other, our colleagues, to help in reigniting, to have that voice. And I think it just goes to that quote that amongst some of the darkest times, we need to continue to be that light and give a voice to the voiceless. So I encourage all of you to raise your voice and to be able to get us to a place that we can all thrive. And I look forward to doing that work with the National Council and the Indiana Council. Thank you so much for the opportunity.
Oh my gosh, thank you so much. This has been such a great conversation. And yeah, I'm feeling galvanized now to like go and make a difference. So if you hear that, the call to action, folks, if you have a story, please share it. The ideal ways to share it are through your Hill Day, through having separate meetings with members within your state legislature or members of Congress, and invite those folks to come see all the great work you're doing. Like, you are saving lives, you are making the community better. And when they see that firsthand, it makes all the difference.
Absolutely.
Awesome. Well, thanks so much again, Zoe.
Thank you so much for having me.
Oh, yeah, absolutely.
All right. Talk to you soon.
Thank you. Yeah. And for those watching, please keep continuing to tune into Wellbeing Wednesdays. We'll have future amazing guests just like Zoe sharing their story and making an impact on the work we do.